So as with any screen, you identify what we call hits, which are promising drugs or combinations. You then have to validate those hits. So when we do the screen, we do it in very small wells, so in plates which each contain 96 wells, which enable us to do the high throughput screening. We then move on to plates which maybe only have 12 wells, so we can get much more accurate data. And that's kind of initial check that these drugs really are having beneficial effects. And then currently the next step would be to take that into some of our mouse models of glioblastoma. And we tend to use mice in which we've injected cells from patients which grow, and we select the ones that actually grow in a way that resembles the human disease. So we can give those mice very precise radiotherapy treatments, and we can then add in our drugs and see if that shrinks the tumours down, and it ideally makes the mice live longer. We know when we give radiotherapy to these mice that we can extend their life expectancy by a couple of weeks. So when we add our new drugs in, we want to see that an increase in that survival benefit. And that would then be sufficient information for us to take that combination into a clinical trial. With our 3D cell culture model as it is quite useful, but it's relatively simplistic, because within the tumour we've got the tumour cells, but there are also blood vessels, there are also cells from the normal brain, there are immune cells, and they're all interacting with each other to influence the response to treatment. So what we'd like to do is to start making this model a bit more sophisticated and incorporate additional types of cells that we know are present in the tumour. And we're just at the beginning of that process, really.